Hi, my name is Carlina Shotwell, and I'm here to talk to you about a proposed policy that I would suggest dealing with the mental ill within a institution. So let's get started. The health mental health has always been an issue within the criminal justice system. I decided to investigate the topic to provide awareness to not only people like me, such as my peers and family and friends, but also to you. With this awareness, I would like to help bring awareness to the 20% increase of inmates that have a mental illness within our criminal justice system. That number is awfully high, if you ask me. The specific problem I would like to bring to your attention today would be the lack of resources that are provided to the mentally ill inmates while locked up and once released. Types of mental illness, just so that you will know, and we're all on a clear spectrum. Types of mental illness are psychotic disorders, bipolar and related disorders, as well as major depressions. Now, these diagnoses may seem like they're simple, but let me tell you, I was shocked to find out that there are a lot of diagnoses just with these simple mental illnesses, such as anxiety disorders, compulsive disorders, trauma and stress disorders, as well as intellectual disabilities, just to name a few. And honestly, once researching, this list is pretty long. The APA stated that within state prisons, stay with me, 2.3% to 3.9% of inmates within a state facility have psychotic disorders, as well as 13.1 to 18.6% have major depression, and 2.1% to 4.3% have bipolar disorders. Now, listening to these numbers, now that I'm speaking them to you, I hope this is able to really provide an eye-opener for you. Those percentages are very, very high. Did you know that inmates are 3 times more likely than other individuals to have severe mental illness? When I read that and I actually did my research, I was not too surprised, because honestly, realizing what an inmate goes through behind bars, such as their treatment, lack of family support, and things of that nature, I can only imagine the amount of depression that they're really going through. Once again, I'm here to provide awareness, to let you all know that a policy needs to be changed to implement what is going on now within the criminal justice system, as well as the institutions behind their bars. My research began to open up my mind to questions such as, is the criminal justice system more of a place for the mental health individuals rather than for criminals? And if this is the case, where are the resources? And if there are resources, are they stated clearly within their policies? As far as for my policy, the components for my policies ties to helping people get out of jail and into treatment as the number one priority. I believe that everyone should have access to a full array of mental health services and supports in their communities to help prevent interactions with the police. These supports should include, but not be limited to, treatments for drug and alcohol use conditions, as well as supports like housing, education, and employment, as well as peer and family support, because that is needed as well. If individuals with mental illness do come in contact with the law enforcement, communities should create options to divert them to treatments and services before arrest, after arrest, and at all points within the criminal justice system. When individuals with mental illness are in jail, they should have access to needed medications and support. They should also sign up for health coverage if possible, and should get help planning their release to ensure they get back on track once released from prison. I chose to provide a updated policy for the mentally ill offenders in an institution to bring awareness once again. Now, to do this, I will ensure that this happens by partnering with criminal justice leaders, county and state leaders, and mental health professionals. We can help people with mental illness get the support and services they need to stay out of jail. It was also very shocking to me when I researched and found out that many mentally ill offenders actually go to jail, stay there for a certain amount of time, of course, upon their sentencing, as well as get out, and without the correct resources or help and support, they re-enter jail again. And when you think about it, this provides, not even just provides, this allows overcrowding to become an even bigger issue than what it is already. So a trade-off for my policy to kind of get people to realize the awareness would be the fact of there's too many people in jail. And I don't know about you, but I'd rather have a criminal who actually did criminal deeds to be in jail than someone who has a disorder which is beyond their control. But if we have resources and we're able to help them and support them and give them the help such as medication, therapy, any type of treatment that is needed to help them mentally prepare to be a part of the world, will help make a difference. And I will ensure this by providing a policy that will help not only the mentally ill, but also people like you and me understand that they're just regular people and they need help. And we have to be able to be there for them to help them figure out what's the best steps, what's the best opportunities, as well as continue to show support to help them. So bringing awareness and providing this policy is definitely needed. It will definitely, once again, decrease the amount of inmates that are in jail who have issues, dealing with mental health issues, as well as it will help stop inmates from coming back into the system who we can potentially help. And this is what I feel like is the number one key element. Once again, there's a bunch of key elements that I can talk about all day long, but just to narrow down a few, these are definitely going to be stated within my policy. And once again, I'm going to use the help of leaders within our community, within the criminal justice field, to help set these statistics straight, let everyone know what's going on really behind closed doors, and being able to paint a picture to make everyone want to be involved. Thank you.